On this episode of GDP2P, what you need to know before you visit the dentist.
I saw bony defects. We saw the pattern on the pantograph where the bone was completely different.
I think the only reason we don't have the information, somehow the teeth and mouth are outside the scope of the average treating physician.
An inspiring close-up of Gaucher patient Carol Lees.
I was born playing music. I pretty much came out and started playing.
Patient to patient around the world.
Although I was trying to help others, it has kind of boomeranged back, and I have received support also.
To show other people that they're really down about it, about having the Gaucher disease, to show them that it's not so bad.
My name is Michael Margolis. I'm a Gaucher patient in Los Angeles. Our first segment begins with a trip to my dentist and a mystery.
In your particular case, I saw bony defects. We saw the pattern on the pantograph where the bone was completely different. Didn't look quite like the cancer, but it was something I'd never seen before. So here's one angle which will show the dark areas in the premolar area. They look like just large marrow spaces, but it's a very, almost what we'd call a multilocular pattern. And in a cyst, you wouldn't have so much of that, but this was scary, and the other part was scary. So let me get a little different angle on that. You'll see it just a little bit now, what we saw before, but from a different, more posterior view, a dark radiolucent area.
Dr. Moffat was stumped and a bit worried about the spots on my x-rays. He sent me to an oral surgeon who took one look at the x-rays and wanted to pull those teeth. Two teeth that weren't painful and were firmly in place. I wasn't so eager. Before doing anything, I thought I'd better do some research. There was almost nothing to be found on the subject. Finally, I did the smart thing and called my doctor. His Gaucher coordinator, Cheryl, did some research on her own. It's a good thing I talked to Cheryl. She found there was some research done by Dr. Zimran in Jerusalem. So I made a few calls, sent out some emails, and tried to get the best advice available. I set up a web conference with two of the best experts I know and some fellow Gaucher patients. Dr. Rosenblum wolfed down a sandwich in the middle of his very busy day to join us. Dr. Zimran took time to join us late in the evening from his home in Jerusalem to discuss this important topic. Dr. Zimran, I understand you became interested in the topic through Dr. Fishman about 15 years ago?
Dr. Stuart Fishman is a dentist who saw a case of a patient with Gaucher who presented with a lytic lesion. In fact, the patient did not know that he had Gaucher disease originally, so they did a biopsy, like a new lytic lesion, suspecting about new things, and they ended up with Gaucher cells. So during one of his sabbatical, he joined us for a couple of months where he did the first survey of patients with Gaucher disease. So this was actually why we started. The major problem, I think, is that, and I'm sure Dr. Rosenblum will agree with me, that apart from this short survey, there have been no real studies looking at the dental features. And somehow the mouth is out of the arena of the hematologists, physicians, etc. So we don't have a lot of knowledge, and most of the information comes from anecdotal case reports, mini-series, and things like that.
First of all, I agree with what Dr. Zimmerman said. This has not been rigorously studied. And this came to my attention about 4 or 5 years ago. One of our patients was having a great deal of dental work, and the dentist was concerned about lytic lesions in the mandible. And the same thing that Dr. Zimmerman mentioned occurred to me, and I started reviewing literature and speaking to people who knew more about this than I did at the time. And when you think about it, why shouldn't there be involvement of the mandible, especially because it's a bone that's similar to, say, the features of the long bones that are involved in other sites of Gaucher disease. So just thinking about it, it makes sense. It's just that we don't routinely do dental films on patients.
We have a question from a patient, Chad Jervich. Chad?
Thanks, doctors, for being here. I'm actually wondering, these patients that show these deformities in their mandible, these holes and lesions, how do they usually fare in the end?
In most of the cases, patient did well despite the fact that the X-ray, whether it's a CT or panoramic, look quite bad. And many times the dentists were concerned to provide the routine care that they would have given to any other patient.
What exactly are these lesions?
There are different reasons, different etiologies to these lytic lesions. It can be just an area with a lot of Gaucher cell accumulation, or it can be a true lytic lesion. And fortunately, both types will not respond very dramatically to enzyme replacement therapy. But I must repeat and say that we do not have a lot of information. We have several patients, but we don't have a lot. I mean, it is something that we may consider, and Dr. Rosenblum, maybe even we can recruit the registry for doing a sub-study looking at all those features, because they will evolve as patient age and they age with enzyme therapy and without enzyme therapy.
A Gaucher patient from Irvine, California, Erica Ostrov, would like to ask a question.
Thank you, doctors, for answering our questions today. I know some patients have a problem where they have death of bone tissue in their hips or their legs. Can that same thing happen in the mandible?
Again, here too, we did not have any patient with avascular necrosis of the mandible or the maxilla, but there have been anecdotal case reports in the literature. And despite the fact that we have been using bisphosphonates to treat osteoporosis in many of our patients, we heretofore, fortunately, have not seen a single case of AVN of the mandible or maxilla.
Dr. Rosenblum, what's been your experience?
A very similar experience. I think we're fortunate that we haven't seen avascular necrosis or osteonecrosis reported with bisphosphonates such as Fosamax and others in the same family. I suspect at some point we'll see a case, but I think none of us have, at least not that I'm aware of.
We have another question from a patient in Orange, New Jersey. Kevin?
I wanted to start off by thanking the doctors for taking their time to answer and address these questions. And my question specifically is, if during the process of x-rays, an x-ray shows lesions, I was curious to know how that would impact the process of getting dental implants.
I myself am concerned. I was called recently by a patient, actually the patient's dentist, to ask me the safety of doing an implant on such a patient. And besides the bleeding risk, I'm also concerned that the implant might not take root in a diseased mandible. And I raised that as an issue with the dentist, who didn't seem as concerned with but that was my suggestion to him. I don't know how you can define that. There's no way of knowing beforehand whether you're going to have a successful implant or not, even in people who don't have bone disease. So in a person who has bone disease, and this patient has known Gaucher involvement of her jaw, I suggested to him that it might not be a good idea. I don't know what Dr. Zimmerman's feeling about that is, but I'd be interested to hear it.
We have several patients who had successful teeth implants performed without complications, even when the X-ray looked bad. I think it's something that we need to study, to work with the dentist and to report. But as I said before, for some reason, the mouth is usually not part of our daily practice and we tend to forget about it. I think maybe we need to good results, as I say, even in patients with bad skeletal disease and with very scary lytic lesion, as in that case report you referred earlier this evening.
Thank you, doctors, for taking time out of your busy schedules.
You're quite welcome. Thank you.
Yeah, thank you.
Be well.
Bye, Barry. Bye.
Okay, my name is Andres Matiz. I was born here in Bogota, Colombia, where I currently live. I'm 29 years old. I was diagnosed in 1998, and I began with my treatment in 1999. What I would like to see is probably how in different countries the patients manage to get their treatments. I don't know if it is as hard in other countries as it is here in Colombia. I would like to see which laboratories are working on different treatments and how are they going. So like testimonials for different people around the world to show other people that they're really down about it, about having the Gaucher disease, to show them that it's not so bad, that you can live with it. There are treatments for it, and you don't have to be sad or down about it.
I was born playing music. As you can see. Oh dear, there goes the screen. Oh, are you okay? Can you get down? Can you get down? Get down. That's a big part of everything that has fed my life and also kept me going. Because it's a place I can go to that I feel safe and is home, and I still have. No matter what's happening, I still have that. My mother could play anything in any key, any song written. The entire time she was pregnant, she sat at my grandma's piano and played. So I pretty much came out and started playing. My dream was to go to Juilliard, which changed when it turned out my dad's office was about 5 blocks away. So I decided to go to Michigan. This is from New York, and I wasn't sure where it was, but I heard it was a very good music school and it was a conservatory, and that it was 700 miles from home. So all those things seemed to be right, and I went out there to Ann Arbor, and it was a very serious conservatory with 5 men in beards who were the composers, and then me. In my junior year, someone asked me to join a rock and roll band because they thought I could play Light My Fire, which I could, because I heard it on the radio, and that was the start of my rock and roll career. And we came to New York and made 2 albums, and that was the Floating Opera. after a concert, he actually asked me out, and we went out on a date and pretty much stayed together. So that was in 1969, and we've been together 43 years. Except for me, because I really didn't want to be a rock and roller. I don't like performing in front of people. I'm much better off behind the scenes, which is why I like writing the music, conducting it, recording it, playing it, but not performing it on stage. That's not who I am, the performer. I did it for a couple years, and it's hard work. You're driving in a van, sleeping on dollies and amplifiers, and eating at McDonald's in the middle of the night, and you don't sleep, and I wasn't cut out for this kind of life, that's for sure. I needed to be home, so I quit. Richard got a playwriting fellowship at the Yale Drama School, and so we went to Yale. Whatever they needed, whatever period, whatever instruments I could get together, I would put together. And it was great training. And I decided after that I wanted to score films. I really did. I was diagnosed when I was 19. So I had a couple of okay years. Not great, but okay. But when I was at Yale, the second year we were there, I had a very severe bone crisis and was hospitalized for a while. And almost lost the whole thing that I had going. I found my place, and it was behind the scenes, and it was writing music for that, and it seemed like the next step was just film. We came out here with really not knowing anyone at all, both from the East Coast, and there were no women film composers, so again, the first two agents I called said, no, we don't do that. And I didn't know how I was going to break through that, but I did actually get hired by a fabulous agent. He had me up for a feature-length film that was being shot. It was a nice-sized movie. It was real. It was Karen Black, Richard Harris, Martin Landau, that kind of a B movie. So I wrote a film score. You know, I had like a police attack with SWAT teams and guns.
Let's hear that.
It was scary. I just didn't know whether I would make it through any particular job or any day, and was needing transfusions and things. This is all before enzyme. So I was pretty frail. I was in pretty bad shape. And eventually got into reading scripts for Mr. Columbo, Peter Falk, who I had met casually, and we talked a lot about writers. He was interested in writers, and I was also, always had been. I suggested some books for him. I gave him a couple of paperbacks for Christmas, and he asked me if I could come work for him and do this, just read the scripts and analyze stuff and read books and find projects for him. And that turned out perfect because all I could do then was read. I was in bed with all kinds of things going on with my leg, and I couldn't walk for about 2 years. So it was great to be paid to read, and I did that. Madonna was setting up a film company at Universal, and they needed someone to run that. I worked by her side, developing films for her pretty much at every studio. Good people, and it was amazing job. And I loved her. Working with her was great. I learned a lot. Got a good education from Madonna about business, about music, about life. When I first started reading books for Peter Falk, I fell in love with this writer, Cornell Woolrich, who had written a lot of these, through the 1940s, film noir. Truffaut had filmed some of his books. They were all dark mysteries, dark shadow, dark woman, dark this. And the one I fell in love with was Waltz into Darkness. And It took me 12 years to make the movie. At the beginning, I had Michelle Pfeiffer attached, and we went through 3 drafts of the script. It started at Warner Brothers, it went to Columbia, wound up at Sony, and then at the last minute it got canceled, and I put it back together with Angelina Jolie and Antonio Banderas, and we shot it at MGM.
You cannot walk away from love.
Who was the man?
What man? I was lost, that's all.
I want to give her everything. Be careful, my friend.
What was funny is that Angelina showed up. She had just gotten married to Billy Bob Thornton. So she shows up in Mexico City with this giant Billy Bob tattoo. Melanie Griffith, who was down there, she was annoyed because Angelina got that after only like a year of marriage, and they'd been married 12 years. And so she went out and got an even bigger part that said Antonio on it. So, at the age of 50-something, I took myself to Sunset Tattoo and said, I want a heart with my husband's initials in it. My favorite part of the movie was, the premiere was fun, and we all got dressed, and there was the red carpet and everything, but my favorite part of the movie was when the credits started and the lion came on and roared. And it felt great.
Elaine Benton is one of the small percentage of Gaucher patients who also suffer from Parkinson's disease. Thinking sharing her experience could be a comfort to others, Elaine sowed the seeds of compassion from her home in Israel.
I was born with Gaucher disease, diagnosed at the age of 5, and diagnosed at age 44 with Parkinson's disease. It was at this point I started writing poetry. And I started writing a daily blog in the hope of reaching fellow sufferers around the world. And much to my surprise, people started writing back to me and commenting on my blog, which is now read in over 70 countries. From this, it snowballed into a whole campaign. I started also writing for the Huffington Post UK section Lifestyle magazine. I was able to reach other fellow sufferers with the aim of giving support and empathy, understanding exactly what they're going through. So initially, although I was trying to help others, it has kind of boomeranged back, and I have received support also.
Armed with new information, I headed back to Dr. Moffat. He had a fresh perspective on the problem.
But after our discussion and reading through the literature, it's really common, especially in the premolar area, which we ended up seeing right here. Here, this is the canine, and this is the premolar here. Right in the premolar area is where I was reading that this is where typically something will look like it's a cyst. And so, sure enough, here it shows up right in this exact same order that the research showed, which, from what I understand, is that the Gaucher cells that infiltrate in the long bones, because the lower jaw is a long bone, so it ends up that it's a little foci for the Gaucher cells. So something I'd never seen before. Okay, so one of the biggest problems we have in dentistry is you get out of school and you've studied all these enormous subjects. Oral pathology, this is my favorite pathology book, has 375 diseases in it, and try to keep that under control and remember that is extremely difficult. So things like Gaucher's disease that comes up, it would be almost impossible to remember that kind of stuff from dental school, especially since it's such a rare disease. So obviously it's very important for patients who have the disease to remind their doctors not to feel guilty or feel unusual about or embarrassed about sharing those type of things, because more than likely they're not going to remember them if they ever learned them in the first place, because with the text being so old and the information being so new, the probability that we have that information or had that information in the past is pretty slim. We have it now.
Before you go to the dentist, check with your Gaucher specialist to confirm your up-to-date platelet count, and platelet function tests establish you are not at risk of bleeding during a dental procedure. Be sure to inform your dentist that you have Gaucher disease and you may show signs of anomalies on your x-rays. If possible, provide your dentist with information about GD. Before proceeding on major dental work, consult with your Gaucher specialist. If there was one thing that Dr. Rosenblum and Dr. Zimron emphasized, it's that this area needs more study. We agree. On our next episode of GDP2P, our lead story will be, does your infusion method match your lifestyle?